Hi guys, in this video we're gonna talk about the gross anatomy of the ear. We're gonna touch on some histological information about the inner ear, and we're gonna talk about some the basic function of the inner ear on how we hear and balance ourselves. However, the more details about the process of these information to the brainstem and the brain itself, and how we exactly have the neurons and the signals reaching the brain, and how we exactly hear, is going to be touched and explained into more details in the neuroanatomy module playlist. All right, so let's start off talking about the ear. Okay, so the ear anatomy, where do you think you guys have your ears? So if you think about your ear, you have parts of it. You have the external ear, you have the middle, and you have the inner ear. So basically, this is where you have your ear deep inside. All right, so this is here you have the parts of your ear, starting from the external ear with its two parts, the middle ear, and the inner ear. Now, to understand where exactly the ear is located in your skull, you need to know briefly about the temporal bone. So basically, your temporal bone is formed of a squamous part, petrous part, tympanic part, and mastoid part. So if you look at the bone from outside, you get to see a flattened part, which is the squamous in Latin. You have a petrous part, which is basically as strong as a stone. This is what petrous means. Here is where you're gonna have your inner ear inside of this bone, and this is actually the most important one in all of these parts. However, you're going to see some contribution from the mastoid part, as it's going to do your posterior wall of the middle ear. And you're going to have also a contribution from the tympanic part. If you look at that from inferior aspect, you're going to see that this part helps in formation of the bony part of the external acoustic meatus. So basically, this is the tympanic part. It's going to share in the formation of the external acoustic meatus. The mastoid part is going to help in one of the walls of the middle ear. However, everything else is basically related to the petrous part of temporal bone. It's basically where you get to see your inner ear inside of it. Now, what are the parts of external ear? So basically, this is your ear, the auricle. It's basically this, what you guys can see. It's the auricle, all right? There are so many parts of it, but to me, I would think that the most important part is the helix, because it's a helical part of your auricle, and a part that is opposite to it, so we call it anti-helix. All right, so if you have a helical in elevation, this elevation helical in shape, so we call it the helix, and then you have your anti-helix. It's something that looks like it and opposite to it. All right, and in that here you have the tragus, you have anti-tragus because it's opposite to it, and between them the intertragic notch. All right, so to me I feel, and also the lobule of the auricle, to me I feel this is the most important parts of the ear, and it depends on your system in your university. You will get to know what exactly you need to know about your auricle. Now, so this is basically the opening of the external acoustic meatus. It's actually the opening of the tube that's gonna lead you all the way to the middle ear. So by the auricle, and you guys can see how it's shaped in such a way it can kind of collect all the sound waves. All right, it collects all of these sound waves to take it all the way through the external acoustic meatus, all the way to start to vibrate the eardrum. I'm going to talk about everything as we proceed into more details. Okay, so these are the two parts of your external ear. All right, now moving on from the auricle itself, we have the external acoustic meatus. So the external acoustic meatus is actually the canal that's gonna take the sound waves all the way from the surrounding environment, and it is gonna take it all the way to start to vibrate these sound waves on the tympanic membrane or your eardrum. The external acoustic meatus is actually formed by a cartilaginous part and bony part. So if you look at this, where's, hold on, I think I skipped one picture. Is it? No, maybe it's written somewhere else. If you guys look at the external acoustic, yeah, I'm moving into the innervation of the auricle, and then we're gonna talk about the external acoustic meatus. That's okay. Now, because I wrote it in a nice way, so I would love to talk about that when we reach that slide. Now, what about the innervation? Now, when we talk about the innervation, the sensation in your auricle, I want you to think about that as it's getting contributions from the cervical plexus. You guys know that we have a plexus of nerves in the neck, and this plexus of nerves, it gives you sensation, sensory nerves, and it gives you motor nerves, right? This is what we call the cervical plexus, all right? The cervical plexus gives you four sensory branches. One is what we call the great auricular nerve, the great auricular, and from the name implies it goes to the auricle, right? And then you have the lesser occipital, all right? And also you have the transverse cervical and supraclavicular. So basically these are branches of cervical plexus. Two of them are going to give you sensation in the auricle. So if you look at the auricle, basically this is coming from your cervical plexus. The lower half of your auricle is by the great auricular nerve, and posterior half of the upper half of the auricle is by the lesser occipital, so both of them by the cervical plexus. And then the sensation anteriorly in the upper half is basically by the auriculotemporal nerve. So again, this is a nerve that comes in the temporal bone. Your temporal bone is here, and it goes to the auricle, so we call it auriculotemporal nerve. It's a branch of mandibular division of trigeminal nerve. All right, so then the innervation of the auricle, the great auricular, lesser occipital, and the auriculotemporal from the mandibular. All right, now, now let's talk about the blood supply of the auricle. So you guys know that we have the arch of aorta that gives you brachiocephalic trunk on the right side, common carotid on the left, and then subclavian on the left. All right. So what concerns me here is the common carotid, because this is the artery of head and neck. Now, as the common carotid proceeds, it gives internal carotid that enters the cranial cavity and takes care of everything inside, and the external, it's gonna take care of your head outside, all right, and neck, of course. Now, the external carotid artery, it has posteriorly two branches, anteriorly three branches, and inside the substance of parotid it gives you superficial temporal and maxillary. Okay, so the superficial temporal and maxillary are the two terminal divisions. Anteriorly, I don't need them for now. I just want you to know that posteriorly, that we have posteriorly an artery called the posterior auricular artery, all right? And you have the occipital artery that takes care of everything in your skull posteriorly. So the posterior auricular, it's actually posterior to the auricle. So the posterior auricular, it's gonna be the artery that supplies the posterior, let's just change the color, the posterior part of your auricle. So this is actually a branch of the external carotid. Now, as the external carotid it proceeds, all right, as it proceeds up, it's gonna give you branches, superior, medial, and inferior. Actually, three of them are called anterior, all right? All of these are anterior auricular arteries. So the anterior auricular arteries are branches of superficial temporal. You get to have branches, and the posterior auricular is actually a branch of external carotid artery, and it comes posteriorly before it gets into the in front of the auricle. All right, so the blood supply is coming from the external carotid artery. However, I want you guys to know that for the venous drainage, we have the same names, but we don't have something called a carotid vein. This is something that we don't have. And anything that you have it as a venous drainage, all right, think about the internal jugular vein. So if you have a branch, most of the external carotid artery names of the branches of external carotid artery, the equivalent names of these veins are draining into internal jugular vein. Okay, so the internal jugular vein is going to receive these auricular veins, because we don't have anything called external carotid vein. All right. All right. Now, talking about the lymphatic drainage, we have pre-auricular lymph nodes, we have infra-auricular, and we have retro-auricular. So, of course, the pre-auricular is going to drain lymphatics from the upper half, and because you know the lower half is a separate part, it's infra-auricular, and the upper half has anterior part and posterior. So the anterior part is going to drain into the parotid lymph, because you guys know that the parotid gland lies actually in front of the ear. All right, so the pre-auricular lymph nodes are actually your parotid lymph nodes, and also the infra-auricular here below the auricle itself, because your ear is here, it's also gonna drain into the parotid lymph nodes. All right, and the retroauricular posteriorly, you guys have your mastoid bone here. So here we refer to these lymph nodes as mastoid lymph nodes. So posteriorly, they're gonna drain into that. Now, where are these going to drain? They're going to drain into the deep cervical lymph nodes. These lymph nodes are actually lying along the internal jugular vein. So to the deep cervical lymph nodes, we're going to drain all the lymphatics around the auricle. And then from there, if we are on the left side of the body, we're going to drain into the thoracic duct. And if we are at the right side of the body, we're going to drain into the right lymphatic duct. And from there, you get to empty the lymphatics into the right angle, which is the junction of the internal jugular vein with the subclavian vein on the right side. And the same thing is going to happen on the left side. And more details about the lymphatics and the basics of that is actually explained in a separate video called the overview of the lymphatic drainage. It's a general concept, and you can find it in the channel itself. Now, moving on from the auricle to the external acoustic meatus, the external acoustic meatus is actually formed of two parts. It's formed of an outer cartilaginous part, the outer 1/3 of it, and the medial or the inner part is actually bony. And the 2/3 of that is your bone. Remember when I told you guys that everything here is related to the petrous part of temporal bone when it comes exactly to be more specific to the inner ear, where is it actually embedded inside, and the walls of the middle ear cavity, everything is related to the petrous part of temporal bone. However, we have a tympanic part. So the bony part of the external acoustic meatus is actually the tympanic part, and posterior wall of the middle ear cavity is actually your mastoid part. Everything else in the ear is related to the petrous part of temporal bone, and forget about the squamous because it has nothing to do with these things. All right, so when we ask about which part is forming the external acoustic meatus, it's gonna be your tympanic part. All right, now I just want to give you another information, which is an interesting thing, is guys, if you think about the pharyngeotympanic tube, because on the sides of the middle ear cavity, yeah, you have an external canal and internal canal, because we need to equalize the pressure, and we're going to talk about that as we proceed. Now, this canal or this meatus, the external acoustic meatus, is formed by the outer 1/3 is cartilaginous, and the inner bony part, the inner 2/3 is bony. The opposite is true when we talk about the pharyngeotympanic tube. The pharyngeotympanic tube, it has an outer 1/3 bony part and an inner 2/3 cartilaginous part, and the internal end of the canal, you guys know it, and you see it in the nasopharynx, which is the bulging of the canal. Um, um, and this is what we see it in you have it explained in the pharynx video. Okay, so this is a cartilaginous part of the Eustachian tube or the pharyngeotympanic tube. Okay, the cartilaginous part, you will get to see that bulge into the nasopharynx. Okay, so these are two opposite to each other, which is an interesting information. Now, what would be the innervation of the external acoustic meatus? I try to make it simplified, which is I want you to remember that when you study the innervation of the external acoustic meatus, you have the superior and anterior part, the superiorly and anteriorly. It's a branch of the fifth cranial nerve. The auriculotemporal branch, which is actually a branch of mandibular division of trigeminal, is what takes care of the superior and anterior parts of your external acoustic meatus. However, the posterior inferior part of your meatus is by the cranial nerve number 10, which is the vagus nerve, and you also have contributions from the facial nerve. All right, now this is also interesting because when we study about the eardrum or the tympanic membrane, I want you to remember that the innervation of the outer surface of the eardrum is basically the same. It's going to be the auriculotemporal, all right, and the vagus nerve, all right? Now, 5 and 10, anterosuperior wall, auriculotemporal, of mandibular, of trigeminal nerve. The posterior inferior part of the external acoustic meatus is by the vagus nerve, and you also have contributions of facial nerve. And we already talked about the innervation of the auricle previously. Now, moving on.